Good morning, everyone. Thank you all so much for participating in the webinar. We gave it an extra few minutes so people could get their audio connected. I think we might have a few people calling in as I go through this introduction. There's a few housekeeping things that I'm going to get to, but first I want to thank everyone for being on the call. This is an important time of year for the Prevention Alliance. I am Leah Festa, Director of the Prevention Alliance of Tennessee. And for those who are not familiar with our organization, we are made up of substance abuse prevention coalitions across the state. We provide statewide advocacy and facilitate technical assistance and provide training for coalitions to prevent substance abuse ultimately. There are a few procedural items I'd like to mention. I don't have everyone muted right now, but luckily it is very silent. So as you do come on the call, make sure your phones are muted. Unless you have a question, I believe Justin might have a few moments where he'll ask for some audience participation, and if that's the case, please feel free to chime in and unmute your phones. There's also a chat box where you can put in questions, comments, just whatever you feel like putting in down there. Feel free to do that. There's also a hand-raising button that you can select in case Justin says, raise your hand if you fall in line with some part of the topic. So other than that, I will be sending a survey after this, just a feedback survey. It helps us better each webinar and provide topics that you all are interested in. And if you need a certificate, make sure you email me. It's leah@tncoalitions.org, and I'll put that in the chat box so that everyone can see my email. And last but not least, a side note, I wanted to let you know we will discuss the white papers, and those are on our website. But our website is actually down this week. I'm hoping it will be back up next week. We've apparently been hacked a few times, so the developers are going to put in a new theme for us. It's just taking a little bit of time, and it's bad timing. So with that being said, I'm going to hand it over to Justin to talk about what's going on with the Tennessee General Assembly.
Thank you, Leah, and thank you, everybody, for being on this call today. Just a follow-up note to something Leah said about getting your CPS hours and the survey afterwards. You do have to give me positive feedback if you want to get that certificate. Otherwise, I'm not signing off on it. But in all seriousness, I do appreciate everybody participating today. This is our first opportunity to really talk about some of the issues that we can expect to see in the Tennessee General Assembly now that they've reconvened for the 110th. I believe I know most people on this call today, but for those who I don't or who I haven't had the chance to meet yet, my name is Justin Sweatman-Weaver, and I've been in coalition work for about 7 years now. The first big chunk of that was spent as the Assistant Director of Power of Putnam in Cookeville, and then I also served as the Executive Director of the Sumner County Anti-Drug Coalition. So in both of these roles, I've had the opportunity to do a lot of state-level advocacy and really hone in on some of these issues that are affecting the work that we're doing in our own communities and kind of the field as a whole. So in addition to this, I've also been, I've had several years of experience advocating on educational issues as well. So like I said, I think I recognize a lot of the names on the list of people who are on the call right now. And just to kind of capture how many coalitions we have, I want to run through a list real quick. So if I don't say the coalition that you're with, please identify yourself. Or if you're with another organization, please identify yourself as well, just so I kind of get a good idea of who's on the call. I see Monroe, Smith, Putnam, Dixon, Coffee, Tipton, Anderson, Lawrence, and Gibson/Milan, I believe. So if I didn't say your coalition or your affiliation's name, if you wouldn't mind unmuting yourself and just quickly giving me a little introduction just for the sake of knowing what's going on.
Chastity from Grundy Lawn. I'm just not on the computer yet.
Hi, Chastity.
Hey.
Amber Knowles from Henry County Prevention Coalition.
Hello. Thanks for joining us.
Hey, it's Jennifer with Power of Putnam.
Hey, Jennifer. Anybody else I didn't identify? Okay, I'll move forward then. So a lot of you probably know that I am actually no longer employed by a coalition in the state, but I am remaining on the board of the Prevention Alliance of Tennessee as the committee chair for advocacy, because I still have a strong commitment to helping find solutions to the substance abuse issues that we're each dealing with every single day, and supporting the overall field of prevention as a whole. And I now find myself in a position to do so in new ways. So I'm excited to continue working with coalitions and providing as much direct support to you as I can on these issues, particularly related to legislative advocacy, because I can tell you, and this is a common phrase from the professional circles, that the 110th is going to be a doozy. So we'll just jump right in if that's okay. Did I do it? Nope. There we go. Okay. So you can see on your screen the agenda for the next 45 minutes or so. We're going to begin by reviewing some of the successes from this last year's legislative season, and then discuss some of the barriers that we've identified as preventing coalitions from being able to actually engage in advocacy. Then we'll lay out some of Pat's prevention priorities for 2017 and some of the opportunities that we have to create positive change, and then we'll end by discussing some of the resources that are available to all of us right now. So let's just begin with a really quick review of some of the notable legislation that passed in 2016. The first on the list is the establishment of a statewide pharmacy practice agreement that would allow pharmacists to dispense the opioid antagonist naloxone. And I know we're all familiar with naloxone. We probably had these discussions certainly in our state meetings, but probably also in our individual coalition meetings as well. But in effect, what this did was make the life-saving overdose antidote more widely available to friends and family of people at high risk for overdose. So getting that in the hands of people who can administer it and actually save some lives on the ground. We also saw new regulations on the licensure requirements for pain management clinics, sort of limiting the patient to provider ratio that's required to obtain that pain clinic licensure. So these new regulations are likely going to lead to the closing of dozens of fly-by-night or understaffed or oversaturated pain clinics across the state of Tennessee, which I know is a victory for a lot of us who are seeing the impact of these establishments in our own communities. The third item I wanted to touch on is the reauthorization of the Prescription Drug Safety Act. And if you're not familiar with this particular law, the original form of it actually led to the establishment of the Controlled Substance Monitoring Database. And this most recent reauthorization last year added additional items that require prescribers to register and report the dispensing of controlled substances more frequently, and made it a little bit easier on them as well by allowing them to designate somebody else from their office to do so. So we're already seeing the use of the Controlled Substance Monitoring Database go up. We're seeing more practitioners and providers who are actually logging in and putting that information in so that we can track it a little more closely. But unlike the Prescription Drug Safety Act, a piece of legislation that was actually not reauthorized is the fetal assault law. Basically, this law was allowed to sunset, meaning the original bill came with a time limit. In essence, it had a trial period to determine whether or not the law was going to have the impact that it was intended to have. And then the state legislature made a decision based on the research around that. And finally, we also celebrated the passage of a coalition sustainability bill, which authorized local governments to redirect revenue from obsolete litigation taxes to go to support local prevention efforts. And this was based on something that had been done, I believe, in Scott County for several years, and was actually proving to be a real asset to the coalition by providing some unencumbered funds. And this was spearheaded by Anderson County, and I know Stephanie Strutner is not able to join us today because she has a brand new bundle of joy in her life, but she was really instrumental in advocating for that bill. So before I move on, I wanted to just quickly pose a question as to whether or not there were any other bills or measures that came around last year that anybody wanted to mention that didn't make this list. And you can either unmute yourself and say this, or you're also welcome to put it in the chat box. I believe I'm the only one that sees that, so I can express it for everybody. All right. I'm not seeing anything, so I'm going to move forward. Here's just a nice little collage of some of the pictures that were taken this year. It's really just a few little snippets, mostly from our Pat Day on the Hill, but we can also see a training that took place there. I couldn't find the original picture of that one at the bottom, if you know Zach, from the Memphis Area Prevention Coalition. I couldn't find the original there. That's actually one that I edited. Vice President Selena Meyer from the show Veep is not actually attending our meetings, although that would be cool. And then you can see Diane Black is also really invested in this issue. But, you know, this was just really a slide to capture kind of some of the activities that coalitions are participating in. But I wanted to highlight in particular some of the assets that we have at our disposal. So, I mean, obviously, thanks to the capacity of our coalition leaders to build relationships with our elected officials, coalitions can actually say that we played at least some semblance of a supporting role in each of the legislative initiatives that I mentioned a couple slides ago. And this was largely made possible by the variety of assets that we have kind of at our disposal, courtesy of the Prevention Alliance of Tennessee. So just to mention a few, this included some really well-researched and well-written white papers that Leah alluded to at the very beginning of the presentation that are available on the website once that website's functional again. But these dive really deeply into some of the core issues that all of us are focusing on in our community and allow us to have these discussions at the broadest level, you know, by laying out the history and all of the social issues that go into each of them. Leah has also been really incredible about doing weekly updates and action alerts and tracking legislation as it changes. If you've never really followed a bill, you know that it can change 6 times a day or more when the legislature is in session and doing things to it, particularly when it's in one of the committees, right? So it doesn't just go from, hey, here's this law, let's vote on it right now. There's a very lengthy process to getting any piece of legislation passed. And I think we did this year a really great job of describing that and making sure that those who didn't really have a good handle on understanding how a bill becomes a law, just ensuring that they had those tools and that understanding through our 3 advocacy presentations, excuse me. Leah, correct me if I'm wrong. Advocacy 101 and 201 are both available on the website, correct?
Actually, just 101 is on our YouTube page right now.
Okay. But we're working on getting all of those available as videos, yes?
Yes. Okay,
great. I thought so. So obviously, you just saw some pictures from our Day on the Hill, which I believe we had 11 coalitions participate in, which is, you know, not a stunning turnout, but it was a rough weather day, and I think those who were there got a lot from it, and certainly our elected lawmakers did as well. And then we also just had some coalition leaders who found themselves at Legislative Plaza multiple times a week, often driving long distances to be there and potentially staying overnight. So we're appreciative to those who made that jump. So overall, we found that 21 coalitions reported using one or more of these assets to connect with an elected official about a coalition issue. While these successes and, you know, this level of engagement is worth celebrating, it's also important for us to note that this number only represents about 1/3 of the coalitions in the state. So the next question for us became, where are the other 40-odd some coalitions, and what can we do to make it a little bit easier for them to engage in advocacy? So to figure this out, we went to the source and actually conducted a survey of coalitions about their experience with advocacy and wanted to identify some of the clear barriers that are keeping us from being able to do this at a much broader level. So the first three that I want to touch on, not surprisingly, were issues that were somewhat out of our control, of course. The first one is driving. We know that Tennessee is a very long state, and it's very difficult for somebody from Mountain City or Johnson City or Sullivan County or Memphis or Tipton County or somewhere far out west to get to Nashville in a day and back home. Just if you don't mind, let's take a quick little poll and see how many people on the call driving or distance was actually a barrier for. So there should be a feature that lets you raise your hand. If you don't mind, just click that little button. I won't call on you or anything, I promise. Okay. 2, 3 hands raised. Yeah, so again, we're a long state, and there's only 17 of us on the call right now, but distance is definitely one of the problems that we're going to face, and absolutely nothing we can do about that, right? We can't fold the state in half or make it a little bit easier. Maybe some carpooling wouldn't hurt, but, logistics in general can be a big challenge. So the number 2 issue that was identified was funding. We know funding is really limited for all of our coalitions. Resources are scarce. And this goes hand in hand with staffing, because if you only have the funds available to fund one person, that person's going to need to be available more often in their own community and maybe not able to do so much work kind of at the state level. So if funding and staffing was an issue for your coalition, go ahead and raise your hand again for me. I'm seeing 7 hands go up. Yeah, so both of those are pretty big ones, right? They're, again, out of our control, but significantly change the way that we're able to engage at the state level. Moving forward, the number 4 reason that coalitions didn't participate in advocacy was the anxiety and uncertainty around the limitations of advocacy and this dirty word that we all hate so much, which is lobbying. As non-profit employees, we really do walk a fine line, and we have to remember that we're each, in addition to a coalition leader, we are also a business professional as well, and we have to do what we have to do to protect that business. So lobbying is always a big no-no for us, but I think we have made a very strong effort to draw the line between advocacy and lobbying, and made that available as much as we can. And we'll talk about some of those resources a little bit later in the presentation, but I want to get a feel for how many people this was an issue for. So raise your hand if the differentiation between lobbying and advocacy was one of your barriers as well. Couple 3 hands, okay. So coming in 5th place, it seemed that some coalitions had challenges with mobilizing their memberships to be the advocates. And one response that I got out of this question kind of stuck with me. It said, we need tools on how to help coalition staff discuss issues with coalition boards and members. They were the ones more nervous about it than the staff. And I think we'll find this to be true in a lot of settings. Because we are exposed to this information more often, and we are kind of meant to be the content experts on these topics, we may feel more comfortable, whereas our coalition members, especially if they're from a sector that's not directly correlated with the issue of substance abuse itself, so something like the media community or the business community, might find some challenges when having these conversations or delivering this information to elected representatives. So if this is one of your issues as well, go ahead and raise your hand for me. Great. A couple hands going up. So the last two barriers I want to discuss I found extremely interesting. Intimidation was actually mentioned a number of times, and this particular statement resonated with me as someone who wears multiple hats at any given time. We send emails, white papers on issues required, but our legislators are trying to pass highly controversial and broadly opposed bills. I fear bringing them into our coalition business opens a platform for their nonsense. So before I talk about that any further, has this been an issue for anyone else? Raise your hand for me. Okay. I'm only seeing one hand go up right now, but I can definitely connect with this particular issue. It's kind of a double-edged sword, because if you are an advocate and you have multiple priorities, I'm using myself here as an example, your legislator, who may be one of your strongest allies on one issue, could very well be one of your strongest opponents on a different one. So that's one kind of piece of caution to take with you anytime that you're doing advocacy work, because you want to keep those bridges of communication open regardless of what the topic issue is, and maintain this mutual respect that you have with your legislator as well. On the other hand, we often might feel compelled to invite our elected representatives to come to a coalition meeting or some other event that we're having. And because we are the professionals that we are, we want to make sure that that is spotlighted. And so we may even give them a few moments to speak. This can be a huge, great thing to have an elected representative speak at your coalition meeting or some other community event that you're having. But one of the consistent issues that I've heard from other coalition leaders, and also have experienced myself, is that elected representative will sometimes use that platform to push their own agenda and not necessarily talk about what it is that you wanted them to come talk about. And so I can think of one particular example in a Middle Tennessee county just in the past few months where I think it was a state senator attended an event where he was supposed to talk about I think it was DUIs or traffic safety, something related to highways, and really went far into left field with what he was sharing with the audience there. So we know that can be an issue because it can also alienate some of our partners and some of our key people that we have around the table, right? So finally, the last barrier that was identified was timing. And ultimately, we virtually have no way of knowing what can pop up during the legislative session unless those elected officials make their intentions known publicly and early on in the process. Even now we're seeing, the state legislature has been in session for a week-ish, just kind of preparing. But even now we're seeing bills that are pre-filed for introduction that contain some language. But in truth, these are still total wild card bills. These are known as caption bills, and essentially they serve to open up a particular code in Tennessee law, and then they just go in and fill in the blanks later. So, even this early in the session, we don't have a great idea of everything that's going to be coming down the line for us. And so we kind of have to just be prepared for whatever comes our way. But, of course, while we have to be reactive to those things that arise during the session, we do have the opportunity to set our own priorities early, which is exactly what we did. So back in May, which was just barely, well, it may have been the first part of June, but it was just barely a month after the last legislative session ended, our advocacy committee convened to discuss our priorities for the upcoming year. And here you can see some of those outcomes. So our top priorities that we identified for 2017, and these are based on a survey that coalitions were able to complete to lend their voice to this, because we knew this Tuesday morning meeting in East Tennessee was not going to be accessible to everyone. So we made sure that we brought all that information to the table, and here's what we found as our 4 highest priorities for the year. The first was tobacco preemption, second, prescription drugs, third, medical marijuana, and fourth, coalition sustainability. And I want us to dive into each of these and kind of talk about some of the opportunities and the threats that we see. So the first one I'll talk about is tobacco preemption. If you're not terribly familiar with tobacco preemption, what's important for you to understand is that the Tennessee Code right now sets a precedent that says municipalities do not determine for themselves what public grounds may be designated as smoke-free areas. And so our strategy here is to encourage more exceptions or exemptions to this law. Basically bills that say this city or this county has the ability to determine for itself what public park or swimming pool or amphitheater they want to make smoke-free. So this has been identified as our number 1 priority and probably one of the areas where we can expect the most movement this year. So some of the opportunities we have right now include a new and stronger white paper, and shout out to Allison and Melanie from Sullivan County, who put an extraordinary amount of work into developing that white paper and making it really thorough and very presentable and understandable. So that will be available again to you as soon as our website is back up. But another thing we have working in our favor is the successes that we saw last year. So there were actually, there was an attempt last year to sweepingly remove tobacco preemption and say that any county or any municipality in whatever form can decide for itself what public spaces they want to be smoke-free. So that got shut down pretty quickly, actually, but the end result actually allowed for 2 counties to designate certain spaces within very strict limitations as places that would be smoke-free. This year, we've actually already seen at least 1 bill that's been filed that would allow Knoxville to designate for itself where they want to designate as smoke-free. We've also seen an additional bill that will allow public universities and colleges to determine whether or not to go as a smoke-free campus. Some other things that we have playing in our favor here include a very direct response from a survey that we did of candidates that said that 62% of the respondents would support allowing municipalities to decide for themselves whether to allow tobacco in public spaces. That's huge because that kind of support did not seem to be in place last year. But on the flip side, we have several threats. And the one that I actually want to talk about first is the disconnect when it comes to local control, because that seems to be a platform that many candidates and many elected officials like to run on or portray themselves as a champion of. But then when it comes to legislation, they don't necessarily let their actions follow their words. So we see this take place largely in committee. Last year's bill never made it outside of a committee in its truest form. Particularly the Agricultural Committee is one that we are fighting very strong on this one. Not fighting. I shouldn't use that language. Let me backtrack that, because we're not fighting them on anything. They are protecting their interests, just to clarify. And then from that same survey of candidates, we also saw that by and large, tobacco was identified as the lowest priority substance because of its legal status, because of its broad accessibility, and because its health impact is not as immediate as other substances like prescription drugs or methamphetamine or cocaine. And then I want to draw a parallel finally between both of these columns, our opportunities and our threats, is that both sides of this argument have very powerful people backing it. Everyone is definitely familiar with the power of the tobacco lobby, without question. But this particular initiative is kind of being spearheaded at the state level by the American Cancer Society, who, unlike PAT and unlike us coalitions, can do more traditional lobbying and can actually go and ask a legislator outright to sponsor a bill. And their strategy right now is largely aimed at engaging local communities to apply pressure at the state level. So the Knoxville bill that I mentioned earlier that would allow them to decide for themselves where to designate as smoke-free is just such one of those bills. The idea being that if we can get, 10, 15, 35 counties or cities to say that they want this to be a law, then we can actually move the needle at the state level. I think that's all I wanted to say about tobacco preemption. Before I move forward, are there any quick questions? Okay. I'm not hearing any, so I'm going to quickly talk about prescription drugs as well. So if you've followed the legislature or if you've been involved in a coalition for more than a year or so, you probably know that Tennessee has made some really big strides to kind of deconstruct our current prescription drug issue. One of the challenges with that is that many are left at the end of the day wondering what's next. And this was absolutely one of the challenges that we encountered when we were setting our priorities for the year. So at this point, we still don't know necessarily what our year of advocacy is going to look like at the state level in terms of prescription drug legislation. But we do have several things working in our favor that I wanted to touch on. The first being public spotlight. This year, if you've watched 60 Minutes or scrolled through Facebook or, a variety of things, then you have definitely seen a lot more attention on this issue. And coalitions doing the work that we're doing still at the local level is essential to ensuring that this becomes a national topic or a statewide topic of discussion. So in both of the surveys that I've alluded to so far, the coalition survey of legislative and advocacy efforts, as well as the candidate survey, prescription drugs was also identified as the #1 priority and the #1 issue that's impacting communities the most. That's good for us, I don't think I have to really say that, but it means that we have the ear. We have the ear of lawmakers. We have the ability to move forward on issues and respond as quickly as they can arise. So leveraging what we have right now is probably one of our biggest opportunities, leveraging the spotlight and this understanding that this is really doing a number on Tennessee communities. Just a couple of threats that I want to mention. The first one is a red herring. And if you're familiar with debating or with logical devices, then you understand what a red herring is. It's something that draws attention away from the actual true problem and onto something else. And this is one of the issues when we begin to talk about a bill that I mentioned earlier, the fetal assault law. Not only did it pull attention away from the root causes of the problems, it also offered solutions that actually did nothing to improve any type of root cause or anything that's actually creating this issue in the first place. And that's why it was allowed to sunset. We also have the whack-a-mole effect is what I call it. You might call it something else. But once we find ourselves in this kind of limbo where we've done all of these great things to try to alleviate the problem, and we just consider it to be solved at a certain point. Not us as prevention professionals, but certainly others outside of the field and potentially even lawmakers. One thing that happens is that we see a sudden rise with another issue, and this is particularly true for prescription drugs, because once we cut off those supply chains of prescription medications, opioids, we often see a rise in heroin. And I'm just curious who is seeing that in their communities right now. So if you want to raise your hand for me. Yes. Several communities who are seeing that rise in heroin. And that is at least in part a result of the incredible work that's been done around prescription drugs. So it becomes kind of this interesting dichotomy where we have to maintain this spotlight on prescription medications while still moving forward to address a new issue and hopefully stop it before it becomes something that is uncontrollable. Any questions or comments on prescriptions? Okay. Just to reiterate, at this point, no bills have been filed that directly address this issue, but we may see some before it's over. It's very likely that we will, in fact. So we will keep you updated on those. Okay, our next priority that we identified was medical marijuana. So far, after the elections, 28 states now recognize marijuana as a legitimate medical treatment. And so our question becomes, is Tennessee next? And what is the best way that we can engage coalitions around this topic? So let me begin with the threats on this one, because through all of our surveying and all of our discussions, we have found across the field that there are mixed feelings when it comes to medical marijuana. So that makes it a particular challenge for us to take any sweeping stance on the issue itself. And then the second threat that we have right now is that we have been told, and history will prove, as this has happened 3 times already, that there will be the return of legislation that is bipartisanly supported to allow for medical marijuana in the state of Tennessee. So we know that this bill is coming. So the question becomes, do we exert our energies to stop the bill, or do we use what we have and leverage the influence that we have to help frame and control it once it's been adopted? And right now, it's kind of a combination of the two, but aiming more towards that control piece. So back in May, or June 2nd, I don't remember when it was exactly, but whenever that was, when we had our advocacy committee kind of thinking session and strategic planning session, we identified a long list of considerations for rules that would control medical marijuana if and when it becomes a reality in the state of Tennessee. And just as soon as the website is back up, that will be available to you. We'll also do probably a bit more extensive training around those policy recommendations, particularly if the bill continues to advance. We want coalitions to kind of be one of the leading voices for how this needs to be handled if it becomes state law. So a couple other issues, well, I just touched on one of those issues, as coalitions can help shape the regulations around that. But one of the other things that I just wanted to briefly mention while we're on this particular topic is that, at the end of this week, we will have a brand new federal administration. And logic seems to indicate that it's going to treat the issue of marijuana very different than our current administration. So if you're not familiar with kind of the regulatory issue or the legal issues around medical marijuana, or certainly even recreational or retail marijuana, it's that the substance itself is still scheduled and illegal at a federal level, despite these states making changes at their state capitals, at their state levels. So it creates kind of this interesting dynamic. And our previous administrations have not taken action. They have deferred to the states to be able to decide for themselves, although it still creates a number of issues kind of on the financial side of things, which is far over my head, so I won't dive into that. But I think we'll just have to kind of wait and watch and see what happens as this new administration takes power, and determine from there, how coalitions can be involved and exactly what that means for us. Any questions or thoughts on medical marijuana before I move forward? Okay. Like I said, there will be a bill, a bipartisan bill, that's going to be filed for this. So we just have to be ready and responsive for when that happens. And we'll make sure that all coalitions have the ability and the resources they need to take action around that. So our final priority that I want to discuss in our time remaining is coalition sustainability. We mentioned one bill that we had last year, but there's been an ongoing discussion about what sustainability actually looks like at the state level. So does the state allocate dollars for prevention services? We know that coalitions get results and that prevention saves lives. We're powerful mechanisms for change, and we are experts on these issues. So an ongoing discussion in the 7 years that I've been in the coalition work has been, why aren't we treated like the experts on the issues? Or why don't we have a seat at this table? So I want to just pull your attention to the opportunities and threats that I have listed here. You're not seeing double, because the opportunities that we have to make progress on coalition sustainability are also some of our greatest weaknesses identified as an organized field. For instance, while we have many, many wonderful successes as individual coalitions and as a field in whole, we have not done the greatest job of sharing those. We also haven't been easily or terribly concise or articulate with our collective impact statewide, which for us is truly essential at making a case for why state funding or any form of funding or support is necessary. And then finally, although we recognize that coalitions have relationships with and can certainly leverage influence with their elected leaders, we seem to notice a broad disconnect amongst those elected individuals about what the coalition is or what it does. So I've mentioned a couple of times that this year we capitalized on the election and took a survey of candidates running for office for the Tennessee General Assembly. Out of those 200-odd candidates, we only had about 30-some-odd responses. But one of the things that we saw really clearly from all of those responses was this disconnect. So about a third of them said that they had some form of existing relationship with their county anti-drug coalition. But very, very few of them seem to be able to draw this clear distinction between actual coalition efforts and what other related agencies like recovery courts or treatment programs were doing. So this was just one initial finding, but there's other evidence further down in the survey that also shows this disconnect. So political candidates were also asked to rank substance abuse issues from most significant to least significant. And we saw these kind of similar results. There's still that disconnect between what our data and our student surveys and our police reports and our, all of this digging that we are trained at length to do to understand the problem. We still see a disconnect between that and what the legislators perceive to be the most important issues. For instance, I believe cocaine placed third, and methamphetamine placed second. And while these are essential issues for many of our communities, we know from our data that, at least at the state level, these are far less used substances and are having much less of an impact than other things, particularly prescription drugs and what have you, and certainly alcohol, tobacco, etc. And the last point I'll make here is that all but one candidate participating in this survey said that they would support an appropriation bill, meaning that they would support directing state dollars to fund prevention. However, when given the opportunity to describe what actions they would be willing to take, about half of them describe measures that would apply more funding or support to treatment services rather than prevention. And of course, we are all trying to get out of this siloed nature where there's treatment and there's prevention and there's recovery, and we don't interact and we don't support each other. But for our sustainability as individual coalitions and as a field, it's really essential that we do draw some lines there. This is something that I've thought about at length across years, that I call the coalition identity crisis. And I think this is kind of the progression of events that we seem to follow. It begins with limited interactions between coalition leaders, which can demonstrate a lack of cohesiveness as a professional field. And this is really kind of the role that PAT was generated to create. And I think we've been making incredible progress on this so far. But one area where we're still lacking is our engagement with members of the General Assembly and with high-ranking individuals, commissioners and deputy commissioners, and other departments. So ultimately this leads to this kind of impact where neither the leaders nor the public, because that spotlight isn't being shined on prevention in the way that it can, they can't differentiate between true environmental prevention efforts and other also fabulous but not us efforts like recovery courts and treatment programs. And so this all kind of results in prevention being excluded from these institutional strategizing and decision-making processes. And this is just kind of a soapbox that I wanted to stand on to illustrate why it really, really is important that coalitions are connecting with their lawmakers and with these institutional decision makers. And just to kind of preface the significance of that power that we all hold, before I jump into the tools and tips for how to move forward with doing that. So some tools I wanted to touch on include the ones that I've already mentioned. Actually, the weekly updates are going to continue, so you'll be receiving those in your inbox each Friday once the legislature starts moving, particularly once committees start meeting and addressing bills that are important to us. This is something that Leah does every week. We monitor bills very closely, see where they're going to be, what's going on with them, and report that to you. Our white papers, as soon as the website is available again, will be up there. Read them twice, ask questions. You can direct those to me or Leah or the authors of the white papers themselves. These were written by your peers and by your colleagues. So feel free to directly reach out to them because they are very well the subject matter experts on the issue. And then, of course, our PAT Day on the Hill. So it's going to be a two-piece event this year, beginning on February 21st with a training, which Leah and I and maybe some other coalition leaders will lead. Once we have a better idea of some of the precise legislation that we want to work on this year. So by February 21st, all of the bills that are going to be filed will be filed, and we'll know kind of some concrete actions that we can take on those. And then, of course, February 22nd will be our actual Day on the Hill. And if you haven't registered for these yet, please, please, please go and do so. Bring staff, bring board members, bring community members, bring students. You know, the more people that we have singing in harmony at this event, the more power we have at that state legislature. So some new tools that I wanted to mention that we're implementing this year. If you received an email from me last week, I mentioned this one. I'm calling it TGA, which is an acronym for the Tennessee General Assembly, calling it TGA Talks. And it's going to be weekly calls every Monday at 1 p.m., beginning on January 30th, to discuss the issues and actions you can take in the week ahead. So we're trying to kind of bookend the week for you. So on Monday, I can give you a recap of what happened last week and tell you what needs to be done this week so that we have a positive result for that weekly update that's going to come to your email on Friday. And if you need to reach out to me, I have a long list of people who have already expressed interest in this, and I'm really excited to get them going. But if you need to reach out to me and make sure that you're on this list, just do so at the end of the presentation. You'll see my email is on the last slide. And then meeting mates. This is not really a formal anything. This is something that's always been available. We recognize that, new staff or whatever issues might be blocking you from setting an appointment with your legislator, it can be nerve-wracking, absolutely. So if you want somebody else to go with you, all you have to do is email Leah, and then either she or I or some other coalition leader would be more than happy to sit down with you and your legislator and just kind of be there as a support. So thinking forward to Day on the Hill, if you want to set an appointment to visit your legislator that day, which I highly recommend, and want somebody to be in that room with you, go ahead and let Leah know. And we can work on making sure that there's another coalition leader or Leah or myself in that room with you. And then we have some Evergreen Tools, Advocacy 101 and 201, which Leah corrected me a moment ago. Only 101 is currently available, but if you want the slides from either of those, or 301 probably, we have that as well. And then the state has actually offered and given us this fabulous advocacy versus lobbying sheet that every coalition should have. But it identifies what is advocacy, what is lobbying, what are the circumstances that must be in place for this dirty word of lobbying to be happening, right? And so I run down those on the screen, but because we're running out of time, I'm not going to go through it unless anybody wants a clarification, and I'll pause for just 10 seconds to allow somebody to ask for that if they do. All right, I don't see anyone. So I'm going to end this with tips for coalitions, which are not like tools for coalitions. If you've ever sat through a presentation with me, you might know that I like to make up acronyms, particularly ones that are fun and helpful for us when we're doing things that might seem daunting or not so fun. And so I started thinking, what are some key characteristics that I have seen in successful advocates? And I came up with a list, and it's, not by any means comprehensive, but I was able to make a cute little acronym from it. Pretty. Successful advocates are pretty. And here's what pretty means. Successful advocates are present, meaning they take every advantage to know and see their lawmakers. They're responsive. I mentioned a few minutes ago how quickly a bill can change at any given time. So we have to be really responsive and adjust to meet the changes that are taking place. Successful advocates are experts and aren't afraid to show that. We have this knowledge, we have these resources, we have these successes. So when you're in that meeting or on the phone or making an email or whatever, don't be afraid to show that you are the expert on a topic. Successful advocates are also very tactful, so we focus on ways to work together even when we're divided. So I alluded to this several times, I think, throughout the presentation, even if we don't see eye to eye, we can still find common ground. And I think as professionals and as the strong personalities that I've always known coalition leaders to be, we are full of tact. And then, I do think it's important to also be true to yourself and acknowledge and tend to your own feelings and well-being. And in advocacy, particularly around challenging subjects, self-care is something that is important and something that is hammered into us over and over and over. So acknowledging what we feel on a particular issue and what we feel uncomfortable even talking about, and being able to pass that off and care for ourselves in the long run. So I see we are 1 minute over time, but I'm going to stop yapping now and take any questions that you have. I realize I had to fly through that, and I apologize for that. I see one chat question. Jenny, could you clarify either in the chat box or over the phone what you need repeated? Okay, got it taken care of. Okay, if there's no questions, I am going to turn it back over to Leah.
Okay, thank you so much, Justin. And thanks, everyone, for being on the call. I know we're a couple minutes over. I just want to say, remember to email me, Leah at PN Coalitions. I put the email in the chat box if you need a certificate, and I'll get that to you within the week. And if you have any questions or if you want to follow up on anything that was in this presentation, please feel free to email us. That's why we're here, so we're happy to help and assist in any way. Nothing's too small, or, I know sometimes people think that they might be embarrassed to ask questions or to ask for help, but please don't be. We're very non-judgmental people, and we're happy to help. So email us whenever, and thanks, everyone, again.